Dr. Pittaway, a question. Almost every dentist I know will tell you that gum disease basically in the end makes you losing your teeth. You know, the infections in the gum, that yellow, ugly pus you have, the bleeding you get, and the smelling you get from your gum, eventually you lose your teeth. And just about every dentist I know considers that to be the worst and the bad, a really bad thing, and the worst thing. Now, here's my take on it. Dentists, I have noticed, do a fantastic job at replacing teeth. Dentures, and crowns and bridges, and of course the new thing since about a decade or more, a couple decades actually, implants. They become very, very good. So, yes, it costs money, it's a hassle and all that type of stuff to do it, but at least it can be done. However, here's what looking at it now, I need an answer from you of how far off I am. If you lose your teeth after what, 2, 4, 5, 10 years, give or take, right? Depends on how bad and fast it advances, and that's body by body and all kinds of stuff. Am I right there?
There's a lot of variation, yes.
Okay, so after you lose your teeth, and they're like unsavable, so to say, in the meantime, not only did you have a stinky mouth, very most likely, am I right?
In most cases, yes.
In most cases. So,
it's
but
yucky.
You for sure had an infection in your mouth. The mouth is the gateway to the blood vessels. You know, doctors will have you taking certain vitamins and minerals and whatever tablets under the tongue to, so to say, revive you and get it into the blood fast. So right there, that's the place where you have an infection. And I have heard dentists saying that if that infection would be on your hand, it would cover the palm of your hand. Now, who the hell would run around with the palm of your hand red
down
and
to the
bloody
bone
and ugly and yellow full of pus? Nobody would. Whether it's on your leg, on your toes, in your wherever.
You would run
to
the hospital.
You run to the hospital. But apparently here, because it doesn't hurt,
yes.
You know, one just keeps it going. Now, if that's the case, that you have that infection in your mouth, the bloodway, the gateway to the blood vessels, it goes into the blood. That's the definition of an infection. It infects other areas. It travels. So it travels into your blood. It goes to your kidney, goes to your liver, goes to your heart, it goes to your brain. It has one foot to the brain, one foot to the heart, another foot down to the liver or to the kidney, and it poisons you. And infections, you need soldiers, you know, the immune system soldiers to fight them. So they all go there. It's like we have an Iraq war, we have an Afghanistan war. Should we have another Korean war? Where are the soldiers coming from? You know what I mean? Difficult. Wouldn't that be one of the major problems over the time, the infection? Never mind the tooth loss, because you guys at least with money can replace it. But you cannot replace the kidneys, the liver, and the blood. You cannot replace 5 or 10 years of fatigue, of lowered immune system, with women still not stillborn babies, yes, in California, but also underweight baby, premature pregnancies. I mean, name it. How far off am I there? I mean, I'm passionate about that.
Actually, it's worse than you think.
Oh my God.
That chronic inflammation from the disease and the infection in your mouth increases your risk for some cancers now, they're finding. Pancreatic cancer is one of them. And they're finding associations because the gum disease doesn't have a lot of symptoms. And so people don't worry about it, and they don't know why they don't feel right. They feel run down. It clogs up their arteries. They find the bacteria from gum disease in people's arteries. Research is showing the increased risk of heart attack and stroke from blood clots. And of course, there's all the normal things with gum disease: the yellow teeth, the bad breath. It hurts to chew. The teeth are loose, and it's just kind of gross. And it's preventable. And you know, treatment for gum disease is very important. I think that's one of the most important things we do.
Well, I mean, based on what, you just said, and based on what I said and what I heard from other people here, it looks to me that maybe, we're running around and we say, people have all kinds of illnesses and they wake up fatigued and tired. Well, I'm not saying that it's all coming because they have gum disease, because they don't all have one. But again, it makes so much sense that when you have an infection which travels through your body, I mean, you don't want. As a kid, you learn it. When you cut yourself, go and get a tetanus shot and all kinds of things. And here, you're running around with a full handful of infection right in your mouth. It must be detrimental to the health, and maybe that is where many health problems come. We already discussed that how a dentist, by preventing the bones from shrinking once the teeth are missing, by doing implants, make you look better and more beautiful and gorgeous, takes 4, 5, 10, 20 years off of, maybe not 20, but anyway, it takes a bunch of years off of your life and makes you, I mean, all that is a confidence problem. I mean, if people wake up, I want to write a book about when people are tired and exhausted. Of course they don't come up with new ideas. They don't come up with how to solve problems in their life because they're tired and exhausted. And maybe, not totally, but maybe lots of it starts with a gum disease. So I think, I think it's devastating, and you agree with it. So let people know that they should check out their teeth and, their mouth and get their infection out of their mouth.
Well, absolutely. That infection can be devastating to your health, and even to your life, and other people in your life can be affected by it. I have people come in and complain. They don't want to tell their spouse they have bad breath. They,
what did he do? Never kiss her or what?
Well, we try to encourage them to get treatment, but, we have solutions for all that.
Exactly. We're going to talk about the solutions, and of course, anytime you need to go to fix something, whether it's accounting with your accountant, or whether it's whatever it is, or your gums with your dentist. Oh yeah, of course, that's not what we bargained for, but it is, with no doubt, by a long shot, the lesser of two evil, isn't it?
Absolutely.
Thank you.